Good day, everyone. Bonjour à tous. Welcome to this first ever talk of the TB Talk series presented by Indigenous Services Canada. Bienvenue à cette première session de la série Parlons tuberculose. Si vous voulez écouter en français, veuillez cliquer sur le globe terrestre en bas de votre écran et sélectionner français. My name is Cynthia Tartabell. I'm a nurse advisor for the TB program at Indigenous Services Canada, and I'm joining you today from the traditional and unceded territory of the Algonquin and Anishinaabe people. And I acknowledge wholeheartedly and with gratitude and with respect the First Nations and Métis people who have lived on this land since time immemorial. Thank you for completing the poll. It has launched or will be launched shortly, and there will be another short poll at the end of this presentation. And we appreciate your feedback to help us evaluate this pilot TB talk and improve future events. And so to start this talk in a good way, I would like to invite Elder Sequoia to provide both some opening remarks and a song, as she will need to leave this meeting to join another and cannot stay until the end. So welcome, Sequoia, and thank you so much for being here.
Thank you for that, Cynthia. Kayachtan, I welcome each and every one of you to the ancestral territory of Squamish Squamish Nation, where you're joining me on my iPad, and I welcome and acknowledge, honor, respect the First Nation lands and territories where you live, work, and play and are joining today. I'd like to say that you have an awesome team gathered here and presenters to be with you, and I hope that you all learn a lot during this gathering that we're having. I'm Sequoia Quashaman Sna. My ancestral name's Sequoia, and I'm Anwanic from the Squamish Nation in our territories in British Columbia, which is in the North Vancouver, Squamish Valley area. So I raised my hands to you and welcome today. I'm going to share a song that's Sisolia song that our elders fixed and called the Snowbird Song. It's a healing song. So I'm going to share that and do a prayer. And then I unfortunately have to leave you. So I'm leaving you in capable hands. So let's come together, open your hands, have a few breaths to ground yourself. While I sing, pray for each other, this gathering, and all your family, friends, and communities. Oh, oh, eh, oh, eh, oh, eh, oh, eh, oh, eh. Ah, eh, oh, oh, eh, oh, eh, oh, eh, oh, eh, oh, eh. Ah, eh, ah. Oi, Chika. Chenque mentomi kakakana chesiam yonso tanoyap and manman squalwin squalls deceits, asking you, Creator, to watch over all your children gathered here today and all their family, friends, and communities where they're originally from and where they live, work, and play. Help put a shield of safety and protection around all of them and help them with their squalwin, the feelings in their hearts and minds and their mental, emotional, physical and spiritual health and wellness. Asking you, Creator, to let today be a yet one halt, Zaitop, an excellent work today, with everyone coming together in Chomot Squalwin with one heart and one mind to have a transfer of knowledge and information, help all the presenters and with their Squalwin and their words, Let the words that are spoken and listened to be with Winox's respect, taking into your hearts and minds what's meant for you today. Set aside what you don't need today to bring back another day. And let all of you as knowledge carriers in your own right have that transfer of knowledge and information to be able to move forward and create positive solutions for the present and future. Asking you, Creator, to let us all have an excellent rest of the day and a long weekend as we go into remembering all the veterans and National Indigenous Veterans Day, and lifting my hands to everyone. Tama Kwetsi Snechum. Those are my words. And I thank you for letting me share as the opening and closing, and have to leave now. So have a yet one halt top and excellent work. You rock, women warriors.
Thank you so much, Sequalia. I really appreciate your words, and they're going to guide us through this TB talk and discussion today. I'd now like to turn the floor to our wonderful presenters. Evelyn, we'll start with you. If you could introduce yourself and let us know why you feel it's important that we talk about person-centered care.
Good afternoon. My name is Evelyn Henry. I'm from the Ochapois First Nation. I'm a Cree. I'm 64 years old. I have I had 10 siblings. So I have many nieces and nephews and grandchildren. I am a residential school survivor and a TB survivor. And I really believe that what we're talking about today will help somebody down the road, even if it's one person. Thank you.
Thank you, Evelyn. Elizabeth, could you introduce yourself and let us know why you feel person-centered care is so important?
So thanks for the invitation to talk to everybody today and to work with Evelyn on this talk. So I'm Elizabeth Rea. I'm a public health doctor. I work with the tuberculosis program in Toronto, which is traditional land of the Mississaugas, the Anishinaabe, the Chippewa, the Haudenosaunee, the Wendat, and of course, lots of different Indigenous folks living in Toronto. So I guess the reason why I think this is a really important topic is partly because it's the right thing to do, but also because it really works. And if we believe it's important for people with TB to get better, to be cured of their TB, this is a really important way of working for us all to know about.
Thank you both. We're just so lucky to have you present on this very critical approach to care. Elizabeth, could you get us started with an overview of what person-centered care is, please?
Okay. So this term person-centered care gets tossed around a lot in healthcare, partly because it's not a new idea. It's been around for probably 50, 60 years. And it gets used not just about tuberculosis, but all kinds of things, diabetes, cancer care, all kinds of health issues. And I think the best way of thinking about what does it actually mean in practice is kind of the idea that we're as healthcare workers, we're working together with the person who has whatever it is. And we're trying to get together to the same place of that person being healthy. But there's lots of different paths that we could go. And the important thing is the goal, and that we get there together. And that the person themselves is often the best one to actually figure out what's the best path to get to that joint destination. So the first principle is that none of us are just a disease. We're a whole person, and whatever health problem we have is happening in a context. So you can't just focus on the disease. You have to look at the whole person. And by the same token, there might be some things that really don't change much. There's only some medicines that work against tuberculosis. But there's lots of, within that, there's a lot of choices about how to take the medicines and when to take the medicines and dealing with side effects and all kinds of things where it's important to take in the person's own values and wishes and priorities. And that gets to the next part, that the person themselves has to be at the center of decision making, that it's a partnership. It's not just the healthcare people saying, you got to do this, that the person themselves is an active partner, in lots of ways, the most important partner of getting to that being healthy goal. And that means that for healthcare providers, one of the biggest parts of our jobs is giving information and education in such a way that the person themselves can make informed choices. And so centering those informed choices around dignity and respect and people being able to choose their path to that destination we have together is really important. So it's not so much about doing any one specific thing, but it's more like an approach to working with the person and the communities that we work with on healthcare issues, and having the person be, in a lot of ways, the person with the map and making the choices. Which road is the best road to take for me to get to that being healthy destination?
And I know in our past discussions, Evelyn, that you shared that your family has been impacted by TB in the past, starting with your mom. Can you share more on this and why it was important for you that your community support workers knew of this?
Yeah, like I stated before, my mother had TB in 64, 65, 18 months in there. I have a brother that was born there. You know, back then, like you keep saying it over and over, and I'm going to continue to say it over and over, is there was no help outside the hospital. You had to go into the hospital and be away from your family to get the treatment for TB. Now, I don't know if they did the same treatment for TB back then as they do for today. That part I don't know. But for me, my TB was in my left ovary and my cervix. So it was very, very painful. I cried many times, like I said before. So it's really good to have you people on that side saying, Evelyn, what can we do for you? Like, you know, how can we help you?
And I think this leads nicely into our next point. And Elizabeth, would you be able to walk us through the key messages? I think this idea of really asking the client, what can we do for you, is going to come across throughout the presentation over and over. It's so important. So yes, please guide us into what the key messages are today.
So it was really interesting when Evelyn and I were talking about what we wanted to say, because we both came up with really similar issues that we wanted to talk about. So this is the list that we came up with. So the first message is, it works. It really does make a difference to getting people all the way through TB treatment to being cured. The second one is around really listening to the people that we're working with. That what they have to say is super important to being able to figure out solutions to whatever problems might be in their path. Being aware of resources and supports, that this is going to lead to straight to the last one, that there's not only one way to do things. And it's important for the person, but also for us as healthcare providers to know what kind of resources and supports are out there. And this is also probably where I should say should be out there. And then the last point is to be flexible. Like I said, there's many different paths to get to that destination. And so to not get stuck on rules, but really figure out, you know, the important thing isn't always, you know, exactly which method, but that the method works for this person.
Thank you. I'm excited for us to get into it. So please, could you introduce the first point of how person-centered care really does work? Okay.
So the big thing I wanted to say here is that it's not just a nice idea. It has been an approach in healthcare that's been around for a long time. So there's lots of, you know, like published studies and experience in many different programs in different types of healthcare, from diabetes to cancer care to pregnancy to tuberculosis, and in many different parts of the world, that it really does make concrete difference in people getting cured or their diabetes being in better control. So a really nice example for TB is the experience in communities that have food insecurity. So where malnutrition is a big problem, food is really expensive. It's hard for people to get good food, healthy food. So the experience that if somebody in a household has tuberculosis and you give extra groceries to the other people who live in that house, then they're way less likely, the rest of the house is way less likely to get tuberculosis themselves in the couple of years after. So that's recognizing the context for tuberculosis in communities that have real challenges with access to food, and tackling one of those kind of surround issues for TB made a huge impact on TB in that community. So yeah, so it's not just a good idea, it's a practical idea.
It really does work. And Evelyn, how did you feel person-centered care worked for you in your journey?
Well, it worked. I don't know if I'm getting beyond, but I mean, it helped through, well, I set a chart too. I had a chart, and whenever they came, the TB person would come in and fill out this chart and ask me how my night was before and all that. And then when I did it on the phone, because I asked if I could do it over the phone due to the condition I was in, and they paid for my phone bill. They gave me nutrition. Like, I keep saying that over and over again, but it's just a good point, because when you're sick, you don't feel like eating or anything. And I was so thankful that I was given juice boxes, whatever, what do you call those? Fruit cups, puddings, apple sauces, water. But it really helped because, it forced me to eat too. Like I'm saying, I had to eat it because it was given to me, but it was just portions, right? And what the size of a juice boxes or a pudding in that. It's not very big, right? But still, I took that. I ate it and I drank it, and I don't know, it just and the people on the other side that came into my house or on the phone, they asked me how I was, how I'm doing. They didn't just say, okay, Evelyn, you gotta spell your name, give me your full name. They asked me how I was. They made me feel like they cared, right? And when you have somebody that makes you feel like that, then it helps you more every day to take your meds and to take them at a certain time. Because when I first started taking them, I tried to take them 9:30 in the morning and then I switched to dinner time, but I found that dinner time was a better time for me, because I got to eat in the morning before I took them. If I ate after I took them, then they didn't agree with me. It made me feel, how do you say that? Like nauseated, or like I was going through menopause again. And I don't want to like to go through that. And but there's so many different factors. And like, as we talk each time, I think of other things, and I just want people to know out there that, there's different, what do you call that? What's it called? Triggers, I guess. Triggers that, but I just advise people that have it, take your meds, geez, take them. Be thankful you're home with your family, be thankful.
And I think it's through all of these supports, you've brushed on them, and we've talked about them in the past together and our other discussions preparing for today. There's just so many factors, so many supports along the way that helped you get to the finish line. And you did mention just how the support staff really listened to you. They didn't come in and just make sure you're taking your TB med. They're getting to know you and cared about you, is how it made you feel. And this just really, it leads nicely into the next point. Elizabeth, could you tell us why it's so important to listen to our clients?
So this is really because the person themselves is going to know better than anybody else what's going on in their body and what the context is for them trying to do this thing about taking the meds every day and getting to appointments every month, or whatever the issue is. So one way of thinking about this is flipping it the other way and saying, if things are not going well, ask why. Because the person themselves can almost always tell you. And that becomes a starting point to work together to solve the problem and be creative about finding a solution. So, for example, if somebody is missing appointments, ask why. And it might be because they can never get a ride. They need help. They need someone to pick them up to actually get to the health center. Maybe it's because the appointment is right at the time when they're picking up little kids from school. Maybe it's because they're scared and they really need someone to go with them for support. So that actually listening will point the way to figuring out a solution for a lot of challenges.
And I think you're leading really nicely into the next point, which is ensuring that people have those resources and supports they need. They have the awareness of them and the access to them. Could you tell us a little bit more about this?
Right. So this is partly being able to, if we're going to give choices to people and say, which one of these choices do you think would work best for you? Like, is it going to work best if I come to your house for DOT, or by phone, or by video, and what time? It's important for us as healthcare workers to know what those options and resources are so that we can talk with the people we're working with about them. I think from this point of view, I also want to talk about a little bit about healthcare workers that aren't nurses doing direct care, but that are like CHRs, or other kinds of community support, community outreach workers. Part of this is even if you're not doing direct care, it's important to know the information about tuberculosis and what does TB care look like, because that way you can help other people in the community know more about the whole issue, feel better about it. And I feel like CHRs in particular are in a really unique position to be able to tackle stigma about tuberculosis, which can be such a challenge and such a hardship for people going through TB care. If other people in the community are like, oh, you have TB. So being able to give that information about tuberculosis is a big part of this awareness of resources and supports.
Absolutely, because
not just
stigma can
direct
be
therapies.
such a stigma can be such a big barrier, right, for people seeking care. So yeah, the more awareness, like you said, they play such an important role in getting the word out about TB, about when it is contagious, when it's not contagious, and breaking down that fear and stigma. And I was wondering, Evelyn, would you mind sharing what resources you felt helped you the most in your journey?
I just have a comment. I was trying to put my hand up there, but I wrote it down anyways. When a person has TB, our health department know who's the TB nurses, right? So if that person was to come into the health clinic, the rest of the clinic knows why that person's coming. So that's kind of hard on a person too. Like, I would imagine, like, if I had to come to the health 5 times a week, and I'd come in with Abby, or Nicole was the other one, like, I would feel really like everybody's looking at me, like, kind of thing, I wouldn't feel right. So I'm very thankful I had it at home. Another thing, I just wanted to get back to your question there.
What resources? So that the
Oh, the phone, the asking of questions, like how I was. The phone was the main thing, because then I was able to stay home. Like, I didn't have to go out, or if I was out, I could just take my meds. But the phone was a big thing. I still say that today. Like, if I didn't have a phone, I would have a TB health person come into my home 5 days a week, or towards the end, it was Monday, Wednesday, and Friday. And I wouldn't be able to go anywhere. Like, I'd have to stay home. But so the phone was a great big thing. The nutrition was a very big thing. The TB nurse Tracy in Regina was a big thing. She called me all the time herself just to see how I was doing, or text me or message me, like, she always did. And so it's to have those people out there that, I know it's your job and all that, but then again, just the way they talk to you and all that, you got to know them and they got to know you, and you got to know that they cared, right?
That's it.
It's not like just getting on the phone, okay, Evelyn, you got to take your meds, and have them drill them, and like
Being able to take your medications at home and doing it that
and
way.
also, like, I
Mhm.
always wish that I could have took it in liquid form,
Yes.
because I'm not I hate pills. But I ended up taking them. But I'm just saying that, some people, they're not so lucky, they can't swallow a pill.
That's
Like,
right.
and if you crush them up, they're gross, because I tried it. But no, that's not the way to go either. So I'm thinking liquid form, because you can drink your water with it, right? You can down it right away, but then it would be easier. I think that's just me. Everybody's
The support that helped you was being able to take your medications at home over the phone instead of having people in your space, which you've shared with me is not something you really like. And then also, and then the thing you're telling us that you wish, the resource you wish you had, the awareness you wish you had, was that some of these medications could have been taken in liquid form, but you didn't know that and it wasn't made available to you. So that's something.
Yeah, and that's why I always say, well, I'm letting you guys know, ladies and men, that a few times that I talk to you, you have to ask, because as First Nation people, at times we don't want to say or ask because we're humble, we're shy, we're whatever, like, you know, we don't. So I think better coming from you guys, I think, are people, you should ask, hey, Evelyn, what's bothering you?
Yeah.
Are you sleeping? Are you eating? Are you is your back sore or anything bothering you? Like, you know, like, I think that has to come from you guys too, because I didn't say it right away. Like, I didn't tell them right away what was going on with me. And for the last, I think it was 3 months, I bet every comment on the days that I took my meds was I had a sore back.
Yeah.
You know, I didn't sleep, I had a sore back.
What
But
I'm
at least-
hearing is that the
Go ahead.
community health workers, the support workers, they play a unique role. Although some may not provide care, you know, you could be a transport driver, receptionist, but if you're hearing this from someone who's accessing healthcare, you can be part of person-centered care and relaying that information to the healthcare staff. You play a part in this person's care. And so that's a really awesome point. I know we don't always necessarily think of, but this information is part of the person's context, right? This is
part of their well-being, like, you know.
That's it. And it leads into being flexible with how you provide solutions, you know. You mentioned the phone call earlier, like taking your TB meds by phone instead of in person in EDOT. Elizabeth, could you elaborate a little bit about the importance of flexibility and problem solving with practical solutions?
Yeah. So this part is really about keeping that goal in mind of helping people get all the way through TB treatment so that they're cured, so that they're healthy. So this is really about being, it's good and okay to be creative and not just always follow kind of like the rules of how we ordinarily do TB care. Like DOT always has to be in person. Not necessarily. The important point is that people can take their meds. So this is really about encouraging everybody who's involved in TB care, from the person themselves to you know, the person who's working the reception desk at the healthcare center, to the nurse, to the doctor, to the program manager, to be creative about solving problems. And so, you know, really that's everything from what time to take DOT or how to do DOT to, well, maybe the appointment could be by video so that, you know, Evelyn can go on a holiday and not feel like she's stuck in community the whole time and can't go visit her sister in the next community over or something like that. And so this again is a place where, with that creative problem solving, that's not just about the nurses. That's everybody who's involved in TB care is in a position to help with that.
Absolutely. Evelyn, would you mind? I know it's come up, and all of these ideas are very much interlaced. Could you tell us about how getting the phone bill covered made an impact in your care?
Like I said previously, my husband and I were both ill at the time, right? And of course, we're both not working, and we were blessed with having a phone from the band to begin with because of COVID. So not thinking right away about it when I first diagnosed with TB, I thought, down the road, like, you know, things were getting tougher and tougher on us, right? So I called the TB nurse in Regina. Or no, I asked Nicole first, and I think she called Tracy. And then that was like a Friday, and then a Monday already my phone was paid for. They just sent me I don't know, a code or something, and I punched it in, and I didn't have to worry about my phone. And it was paid, like, my phone bill is up on the 28th of every month, right? But it was paid on the 23rd of every month. So they wanted to make sure I had my phone, right? Because if I didn't have my phone, then they couldn't talk to me in person and whatever. Then they would have to send somebody, right? And I didn't want that.
Which isn't what you wanted. Yeah. So this is a simple solution, and it's not part of a set program of incentives or what have you, but it was a concrete solution to helping you get the care in the way you needed, you know, was having that access to care through the phone.
That's why I say you always have to listen to the person that's going through it, because you don't know. None of us know, just the person. Just I knew what I went through. I'm the only one. Nobody else, you know, they could see it, they could feel it, because when I talk about it, you know, there'd be whatever. But that's why it's very important to listen to the person that's going through any kind of disease, whether it be diabetes, TB, cancer, whatever. Like, you know, whatever it is, just listen to them. You know, take the time to say, like, is there something else bothering you or whatever, like, you know, or is why you're not making your appointment? Is there something I could do? Like, you know, in a good way, not in a, like, a professional way of saying, well, we can get you a ride if you need one, like, you know, something like that. Like, you know, do it in a good way, because when you're not well, you don't want to hear people speak to you that way. Like, you know, you want to hear the caring in their voice and all that, you know, and that's what I got. I was so thankful. I pray that I don't get it ever again, but like I said, I don't know if it's gone or if it's sleeping, because nobody told me. So I'm still has that in the back of my mind, like, you know, but you think of everything, right? Once you go through something, you think of everything. You think of the afterthought, and how come they're not looking into it to see if it's gone? Of course, I believe it's gone because I'm not in pain anymore, but it's still the idea of why was there not a follow-up, I guess.
Yeah, you've been through so much, and it's been quite a journey, and I feel, and I'm hearing that it still goes on to this day, you know. It's once you're done your treatment, the experience doesn't just vanish, you know. You're still living the impacts of what you've been through, and I'm just so thankful to both you, Evelyn, and Elizabeth, for generously sharing.
And Abby.
Yeah, thank you. I gave myself a note. I was just about to say it. And Abby, she's a community health nurse in Saskatchewan, who's facilitated our connection with Evelyn. So just thank you to all of you so much for making this presentation come to be. We have gone a little bit over time, so we'll continue to power through. And so if you can stay connected, please do. The recording.
Send me another email of this afternoon. I mean, and can you please tell the elder, thank you from me. Thank you for the prayers and the song.
I will. From us all.
Yes,
it really does change just the context for the talk. She does really help it come to be in a good way. I very much appreciate her too. I will let her know. So we will stop the recording now. And you'll notice there'll be a poll that's going to appear. So please take a moment to complete this